Walk into any high-volume clinic from Kathmandu to New York, and you will see a system operating at maximum capacity. Waiting rooms overflow, and clinical staff are caught in a relentless cycle of triage and treatment. Healthcare systems pour millions of dollars into advanced medical technology and years into rigorous clinical training. Yet they routinely neglect the physical spaces where that care actually happens. This neglect creates a bizarre operational reality. Highly trained nurses and doctors, a massive portion of their shifts functioning as inventory clerks, digging through overstuffed closets and disorganized supply rooms just to find a basic instrument. Industrial engineers use a tool called a spaghetti diagram to map this inefficiency. By tracing the path of a clinician gathering materials for a single routine procedure, you reveal a chaotic, tangled web of wasted motion. This excessive walk time physically drains the staff. Every minute spent pacing the halls looking for an IV bag or a specific syringe is a minute pulled directly away from the patient's bedside. The consequences escalate from there. When supplies are lost in the chaos, treatments are delayed. When medications are stored haphazardly next to each other, the risk of a severe clinical error spikes. Disorganized clinical space is a failure of healthcare infrastructure that actively endangers patients. The solution to this chaos originated on a very different kind of floor. The Toyota management system relies on a framework called 5S: sort, set in order, shine, standardize, and sustain, to maintain a precisely engineered physical environment. When hospital administrators tried to import the system, they almost immediately hit a wall of cultural resistance from the clinical staff. The common response is straightforward: "We are too busy for this. My job is treating patients, not doing housekeeping." That response misses the actual mechanism of the system. 5S relies on the psychological principle of cognitive offloading. By designing the physical environment to store information and dictate workflow, the brain is relieved of the logistical burden. In an unorganized ward, a clinician must constantly burn mental energy remembering where the crash cart was left last, or which drawer holds the right gauge needle. That is cognitive bandwidth stolen from complex medical diagnoses. 5S is a mandatory operational framework designed specifically to eliminate clinical defects and preserve a doctor's mental bandwidth. The framework begins with the first pillar: sort. This is the rigorous process of separating the necessary tools from the unnecessary clutter. Healthcare facilities are prone to hoarding equipment, just in case. Over time, active clinical areas degrade into de facto storehouses of waste, packed with broken monitors, outdated paperwork, and surplus gear. The primary diagnostic tool used to break this habit is called red tagging. Staff evaluate the workspace and attach a highly visible red tag to any item not required for current clinical activities. Those tagged items are then physically removed from the ward and placed in a central holding area for disposal or reassignment. This process also applies to excess quantities of needed items. A ward requires bandages, but keeping a 6-month supply on the active floor creates a massive spatial bottleneck. The core rule governing the sort phase is uncompromising. When in doubt, throw it out. Leave only the bare essentials. By ruthlessly purging the environment of waste, hospitals remove the physical barriers standing between the provider and the patient. Once the workspace is cleared of clutter, we move to the second pillar: set in order. This dictates the strategic placement of the remaining items so they are instantly accessible. Teams use a 5S map to determine optimal placement. It analyzes staff workflow to position high-use equipment exactly where motion economy dictates. By mapping layout to clinical process, chaotic spaghetti paths straighten out, and sidestepping is eliminated entirely. That spatial order is then locked into place using visual controls like color coding and distinct labeling, ensuring every item has a clear, unambiguous home. This schematic shows the organized layout of an operating room's induction and resuscitation drugs, syringes, and tubes. The environment itself communicates how the work should be done by grouping specific clinical kits exactly as they will be used. With these visual controls established, a missing laryngoscope blade or a misplaced medication becomes glaringly obvious. Anyone can spot an anomaly in a fraction of a second. Set in order transforms the physical room into a visual dashboard, where the environment itself alerts the clinician to abnormal and potentially dangerous conditions. The third pillar is shine. In a healthcare setting, this requires dismantling the tradition that cleaning is a chore strictly reserved for environmental service teams or an annual deep clean. 5S relies on a core operational principle. Cleaning is inspection. When clinical staff wipe down their own work surfaces and equipment throughout the day, they are engaging in a tactile audit of their tools. This hands-on process uncovers mechanical and structural abnormalities that a casual glance misses: squeaking stretchers, sticky IV pole locks, slight warping, and early equipment degradation. Because Shine routines target high-touch surfaces, from doorknobs to IV poles, the process removes bioburden and identifies the microscopic cracks where pathogens like MRSA colonize. This dual-purpose inspection proactively prevents equipment failure while simultaneously mitigating the spread of hospital-acquired infections. To permanently lock in the gains of sort, set in order, and shine, we rely on the final two pillars: standardize and sustain. This is achieved through concepts like the 5-minute 5S, turning the maintenance of the workspace into a rapid single-digit minute daily habit rather than an exhausting scheduled event. Sustaining the system requires the staff to shift away from a reactive mindset and adopt a strategy of preventative design. When unneeded items continue to accumulate or surfaces repeatedly become contaminated, the staff must constantly ask why to isolate the root cause of the breakdown. Unbreakable standardization occurs only when a hospital stops fighting the symptoms of a messy ward and starts designing workflows that make disorder impossible. The ultimate goal of the 5S framework is to achieve a continuous state of visual control across the entire healthcare facility. The return on investment compounds rapidly. When search times are eliminated, walk time drops, and patient delays disappear. This leads directly to zero defects. Clinical errors drop significantly because the physical environment is designed to make grabbing the wrong medication or the wrong tool impossible. To understand the true stakes of this system, look back at resource-constrained environments like the clinics in Nepal. When staffing is stretched to its limit, every moment lost to logistics is a direct subtraction from patient care. Eliminating that waste is a requirement for clinical viability. The 5S framework respects the clinician's time. By handling logistics, the system reduces their cognitive burden. By rigorously setting the physical environment in order, healthcare professionals are free to execute the one vital task that cannot be standardized: delivering complex, empathetic patient care.